Hi, my name is Thorbjørn Hansen. I'm from Denmark and I'm from University of Aalborg in northern Denmark. And I'm a philosopher and a researcher in especially what you could call the phenomenology of wonder. And also different kinds of wonder-based dialogues and how you can use wonder-based dialogues in different sorts of professions. When I talk about wonder, it's not the scientific wonder we are used to talk about, wondering about something. Then you are reasoning, then you are seeking for explanations behind your wondering. When I'm talking about wonder, it's when we are caught by something that you wonder at, when you become silent. It's wonder on a more existential and ontological level, even aesthetical and ethical level. So to be in wonder is to be in a state of mind, not even a state of mind, but more a state of being, where you are listening to the world as if you are in a resonance with something that goes beyond your conceptions, beyond what you can grasp with your language. So you could say, what can we use this for in nursing and in healthcare as such, in healthcare communication? I've been working for many years, and I now go to some of my PowerPoints. I've been working for many years now on what I call wonder-based approaches, and for the last 2 years I have been especially focused on what I now call wonder and phenomenon-led healthcare, and that is a kind of addition to what we for many decades has been talking about. That is how we can humanize, how we can rehumanize healthcare system by going from a system and task-oriented healthcare to a person or patient or human-centered healthcare. So I have deep sympathy with this kind of thinking, but I think that to be a human being is also to be more than autonomous, to be more than what I choose, to be more than I have, so to speak, created of meanings and choices in life. To be human is also to be in a resonance with something which is above or beyond what we human beings are, and a kind of reverence towards dimensions in life where we are in wonder, but that make us humble, that make us vulnerable, and that make us human and open, and you can say human, and maybe also playful. And it creates a kind of a community of wonder, where also nurses, and let's say on hospices and hospitals, when they are in wonder with colleagues, with relatives, with patients, around more big questions, existential questions, then wonder creates a space where people meet, so to speak. And this is what I will just introduce you. I have too less time to talk in depth about things here, unfortunately. So I've made some slides which you can have later, where you can go much more into depth with the things I'm going to say here. So in the field of qualitative research, I've been doing wonder-led approaches, but also talk about how art-based research and qualitative research and also action research can be qualified through this kind of thinking. And I also done some thinking, reflection around health humanities, and not only focusing on how art can be helpful in health humanities, but also how philosophy, or to philosophize, not in an intellectual, cognitive, rational way, but when you are existential, driven by a wonder, that's another kind of living in a kind of philosophizing where you are grasped by something. So I've done some books and articles which you can go into if you want. And one of the things that I'm really standing on the shoulders of is the thinking of the existential phenomenologist and also the philosophical hermeneutics. And not to go deep into that, I would just say that when Gadamer, in his big masterpiece, Truth and Method, on the very first 2 pages in the introduction, he's saying that the empirical research and the normal natural science and also social science, they depend too much on methodologies and methods. If you do that, you will not be able to grasp what cannot be grasped by an epistemological and methodological approach. That is the more existential, ethical, maybe even metaphysical experiences and questions. So how do you open yourself up for this kind of dimension, the more existential or spiritual dimension of healthcare communication and healthcare practices? And what he is saying, Gadamer, is that the way he approaches it is through the experience of philosophy and through the experience of art. So when you are more in an artistic moment, or when you are in a more philosophizing moment, you are, as a person, opening yourself towards a listening, a resonance with the world, which you cannot if you only approach the phenomenon through a very methodological and epistemological approach. So there is a critique to also the human science, which is too focused on that. So philosophy, the philosophical and artistic approach, is also what I try to do in my action research projects. When I'm talking about this, I'm also saying that you have different kinds of approaches in healthcare. You have this system-led healthcare, you have task-centered healthcare, and you have, of course, human-centered healthcare. And in the system-led or system-centered healthcare, the focus is on the system, of course, the skills, and on the task-led, it's more focused on the science and the professionalities and the voice of that. And when we are focused on the human-centered, we are focused on the person, how the individual person can find his dignity and find his autonomy again, and how we can help doing that. What I like to add is the 4th dimension, the wonder and phenomenon-led healthcare. This is the voice of the mystery and ethical callings. So let's say you are in a situation as a nurse in this relation with the relative or the patient. You should do this according to the system. You should do that according to the science, the professionality you are in or you are responsible for. And you should, of course, also listen to what the person wants and have needs for. But sometimes you, as a very experienced nurse, also experience that neither of these 3 voices is what really touch you in that situation. In that situation, you hear more on an intuitive level that something is calling you to do something else, and you do that. And later on, you see that it was very good that you did not follow the theory or the techniques of the system or the science, and neither what the person at the moment just wanted, but you followed a more ethical calling in the situation. You heard, you can say, a phenomenon. You heard the phenomenon. You heard the ethical voice of the phenomenon of silence, for instance, or the phenomenon of trust. So there are 4 different ways of orienting yourself in a profession, and therefore also you can say 4 different learning spaces. I do not have time to go into this, but you can read it in the articles I have given you later, and you will have these slides. What I'm also focusing on, that there are different kinds of wonder. There is the scientific wonder, this explaining, seeking wonder, wondering about something, and then you are still in what we call with Heidegger the ontic language, but you can also be in the ontological language, and that is the language of the poem, for instance, or where you are attuned to something that you sense that these words are opening up for an experience that you're trying to grasp. And this is more the kind of philosophical wonder. And then you can also be in a state of mind or state of being where you are living the questions, where you are touched by something more like the artist. And this is also what I call artistic wonder, or wonder, artistic wonder. And that at the end of the day, so to speak, or behind this kind of wondering, maybe there is even a more metaphysical or pre-ontological mystery. That is at least what some phenomenologists, Jean-Luc Marion or Jan Patočka, and maybe also the late Heidegger would say that behind it all, we have the big mystery. And this kind of thinking, I think, can help us to open up for deeper dimension in the existential health communication. I'm not alone in thinking that the sense of wonder is a humanizing force. I have been very inspired by Professor Evans, who has also looked in that direction, when he says that wonder illuminates some of the most intense aspects of living and dying, and the habit of being open to its illumination would, I believe, be very valuable in any area of clinical medicine, and perhaps especially so in general practice. And he goes on saying that, and he quotes Catherine Moore when she says, "I think that a sense of wonder is a virtue, in at least this sense, finding what it means to be fully human in a celebration of our place in the more than human world." So again, the idea that to wonder gives us a kind of respect for that which the human being is not, and also in the same way, on the same moment, you could say, a deeper understanding what we as human beings are and what we really care for. So wonder can be a humanizing force. And when I have done action research project on Danish hospices and hospitals, I have trained some of the nurses in what I call Wonderlabs. And I will talk about Wonderlabs in a few minutes. But one of the things that they have said after being in a Wonderlab and being trained in looking at the world, not in a curious way or in an examining way, but in a wondering way. They say that by asking the wondering questions to the patient, you also show them that you are interested in the person you have in front of you. You are honestly in wonder, and that act and by that act you become very attentive towards the other. I experience that they, in those wonder moments, I can really feel that you are interested in hearing how I am and what I think and what I may like or dislike. So wonder dialogues helps you to become more attentive. Wonder dialogues also helps you into a kind of mutual and trustful nurse-patient relation. As one of the nurses said, we experience in presence of wonder-based dialogues and mutuality. We are in those moments on an equal footing when you are standing in the open. And another one says, to have prejudice is an issue for me personally, but having to ask these philosophical wonder questions, I realize that my senior citizens open themselves up to me in ways I have never seen them before. She laughed. So thus, I have experienced the philosophizing approach as trust-giving. I have received so much back again from the senior citizens and received much more trust by asking in this way. And a third one is talking about how this kind of wondering could also be a tool or a way of going against the instrumentalization, the thinking about a more effective hospitality and so on, where you think too much along the voice of the system. So let me shortly talk about how I work with nurses in a Wonderlab. So a Wonderlab is basically structured by 5 momentums. The first momentum is the phenomenological momentum. Here the nurses in a group give some lived experience of something they have really felt was important to them, or felt an impression that that day something happened, like here it was the feeling of hope, or here it was a sense of dignity. But there was something wondrous about that moment, and then they tell the story. Then they tell a lived experience from that moment. So that's the first momentum, the phenomenological momentum. The second momentum is Socratic hermeneutic momentum. Here they are trained to be more like Socrates, hunting tacit assumptions and values taken for granted in the lived experience and story. And doing that, they become more in getting into a philosophical wonder about the tacit assumptions and values they have taken for granted. So they listen now in a new kind of openness. It could be otherwise, they think now. It could be maybe, and so on. So they also meet each other in a more open way in the dialogue. Then in the third momentum, the aesthetical and philosophical momentum, we take the stories. Let's say it was about hope or silence. If it was if the phenomenon was silence, then who in the art history or in the history of philosophy has talked about silence? And could you bring a movie, a part of a movie or a poem or a painting, whatever, to the room and share that with the other nurses, if that has something to do with the wonder we all are focusing on now? So the group is giving each other different kinds of impressions and from the grand art and philosophy. And then, inspired by that, you can say that they really get into a new horizon. They are elevated by this thinking, and their wonder is growing. But then the fourth dimension is the existential momentum. Who and where are you in all these grand ideas and thoughts? How do you live them in practice, in your daily life? So this is a kind of existential grounding. And then the fifth dimension is the phronetic. Phronesis is the Aristotelian word for practical wisdom. So what is the practical wisdom of this phenomenological and Socratic journey? Which changes in your life and work are called upon? So this is what they are been doing in these action research groups. Now, let me give you an example. There was a nurse who had a telephone call by a relative of an old woman who had just been operated, and they were both very afraid of this operation. Something was wrong, and the daughter of this old woman talked to the nurse. And this is the story. This is the phenomenological moment where the nurse is writing this down in the Wonderlab, and she is giving us this story, and I will just take up a short part of it. I'm sitting now beside my mother, the daughter is saying, and we have been waiting on your call. We have some questions, and please excuse me that you have to talk with my mother through me, but she is too sad to ring herself. She is not able to listen that good in a telephone. I, the nurse, answer, this is quite all right, and it's good that you have called. An image emerges for my inner eyes of the two sitting together, mother and daughter, side by side. A sense of warm-hearted feeling is emerging in me. I ask about the personal data, and the daughter asks her mother to give this information. A fractile, but at the same time, firm voice answer in the background. What is happening here is that the nurse is telling us in the Wonderlab that something happened during that dialogue where they suddenly, a silence came up. And it was a silence when the daughter asked, will my mother be well again? And instead of giving a professional answer, she was caught in a silence, the nurse. And after that moment, she felt something happened. There came a kind of trust between the daughter and the nurse, as if this kind of silence had brought them together. And she was wondering, what was that kind of silence? Are there many different silences? And what was happening in that silence? So in the hermeneutic, Socratic reflection upon that story, and the tacit assumption taken for granted, one of the philosophical questioning she was writing up, or writing in her essay, was like this: was it the silence which gave space for us to meet in a community of uncertainty? Why is it that in the midst of that moment of silent uncertainty, a felt togetherness of trust emerged? It was as if we met each other on a deeper level, where there a kind of certainty in that uncertainty, she wondered. What is really certainty? How could one describe and understand certainty that seems to grow out of a not knowing and not acting? Maybe we became small together when meeting the uncertainty. Did the silence give both of us an inner space that made us become more aware of and present in ourselves? Later on in the dialogue in the Wonderlab, she also raised this question: what is it like to be in silence together? What are we listening to or give space for in that silence? And she pointed to love as maybe the most deeper value of being in that silence, that the daughter felt a caring in that silent moment, and that was maybe what created the trust between them. So later on in the Wonderlab, when she came to the dimension or the existential momentum, because I have asked her to go out in her daily life to look for the phenomenon of silence. And she was very surprised, because she came back and said it was as if the phenomenon silence were living out there in my daily life, in my practices at the hospital. It was like it was a dialogue partner for me. So when we were and then I said to her at that time, when we were together with you in the Wonderlab, you certainly was philosophizing about silence. Now it nearly sounds as if it is the phenomenon of silence that philosophizes with you. When I said that, she looked at me with a big smile and said, yes, this is a good expression of what I have experienced. It really is. I feel as if the phenomenon has become a part of me, if you understand, as if the phenomenon and her are companions now, or in a dialogue together. For me, this is a very interesting description, pointing at, you can say, different levels of how we can understand a phenomenon, and also why the idea of a wonder and phenomenon-led centered healthcare is important. So I do not have time to go too much into it, but I can tell you that I have written about different kinds of silences. So it's not the silence that you instrumentalize, that you use. I'm using this silence in this communication technique. No, it's rather a kind of silence that happens to you. It's on an existential level. And you can say with the little philosopher of Martin Buber that when you are on the more existential dimension, it's the I of the phenomenon. Then it is how you as a person experience being taken by the phenomenon. But you can also talk about silence on an even deeper level, on a pre-ontological level. Then you are looking at, or you are experience the thou of the phenomenon. So I think you can look at this kind of thinking, or this kind of health communication, existential health communication, as having at least three different levels. And levels of knowledge, epistemological knowledge, a level of being, more ontological level, and then you have a third level, which you could call the wonder or mystery level. So this should be elaborated much more, but I hope that that I've given you a sense, or at least it made you wonder about what it is that we can do. Yes, I think I will stop here in order to have some place for questioning. Thanks.